thank you for joining us today. I'm Jill Franken. I'm the Public Health Director for the City of Sioux Falls. This week you heard from Mayor Huther. You also heard from Police Chief Matt Burns, as well as you also heard from Rapid City Mayor and their police chief around the issues related to meth in our communities. We're going to today take it a step further, and we're going to talk about the health impacts of methamphetamine use. These are devastating impacts, actually, to individuals who become addicted to methamphetamine. So today you'll be hearing from Dr. Jennifer Tingley. She's our Chief Medical Officer for the Sioux Falls Health Department and also one of our physicians at Falls Community Health. Dr. Stephanie Schmitz is our Dental Director for Falls Community Health and practicing as a dentist in the dental clinic. And then we also have Sherry Nelson. She is a licensed addiction counselor with Carroll Institute here in Sioux Falls. So we'll start with a short panel discussion first, and I'm going to facilitate this panel discussion, and then we'll follow up with opportunity for questions to be asked. So let's go ahead and get started. Okay, Dr. Tingley, why don't you start by sharing with us some of the health impacts of methamphetamine use?
Sure. Well, there isn't a single system in the body that isn't affected by methamphetamine use. When we talk about the immediate physical effects, it would be on the heart, high heart rate, on the mind, agitation, maybe some tremoring. Respiratory effects, there can be just lung damage depending on the way that the person is using. Also an increased rate of breathing. People can get nauseous, they can throw up, they can have diarrhea. There's a lot of effects on the skin as well. So, I mean, methamphetamine is something that will affect every single part of a person's body.
Okay, so talk a little bit about how it affects the brain as well.
Yeah, so methamphetamine is it's a very powerful chemical. It's a very powerful substance that actually causes the body to release a huge amount of chemicals in the brain. So things like dopamine, norepinephrine, epinephrine, things like adrenaline. We think of adrenaline. There's a huge adrenaline rush when people use methamphetamine. So what happens is patients or people will feel an incredible high or this adrenaline rush after using methamphetamine. After that wears off, there's an incredible crash in those hormone levels. And so they feel very depressed, very slow, draggy, and down. If a person uses methamphetamine for long periods of time, we start to see brain damage that's similar to what you would see with Alzheimer's or Parkinson's.
Okay.
Yeah.
All right. Well, we have heard many times, there's sort of a common term that's used, Dr. Schmitz, and it's called meth mouth, for lack of a better word. I think that's what people oftentimes refer it to. Can you talk a little bit about what you see when related to methamphetamine use as it relates to oral health?
Yeah, it is a common term, and I found coming out and starting to practice, you would see patients, and the difficult thing with finding out if it's meth use is that neglect and high sugary beverages like Mountain Dew can mimic what meth mouth looks like. And so sometimes it's tough to find, is this truly related to meth mouth? But there are kind of patterns within the dental caries or cavities that kind of tip you off to, is somebody abusing this substance? And typically it's smooth surface caries or cavities up along the gum line in areas that are typically not affected in that manner. And the issue is that methamphetamine, one of the side effects is dry mouth and an affinity for sugary food and beverage while they are high. And so that combination is a recipe for devastating effects on the oral cavity. And it hits close to home. I was visiting with one of our practicing dentists in the clinic, and in this week, she has seen 2 patients under the age of 25 who need full mouth extractions and teeth removed due to methamphetamine use.
Okay.
And so it's here, and the effects are devastating.
So it might be safe to say then that we should not assume just because we see someone with tremendous decay, that they are somehow a meth addict. However, that might be one thing for a family member, a friend, someone to possibly say, boy, maybe if I'm seeing my loved one or my friend having these issues, I may need to explore further. Why is that?
Right, and that's, again, that's where it's difficult sometimes because it's hard to get to the root of what's causing this problem, and again, you don't want to offend somebody by immediately going, to addiction, but sometimes they're not as forthcoming right away, but yeah, you have to discern where the issue's coming from.
Okay. Dr. Tingley, you touched on this a little bit, but why don't you talk a little bit more about it? It's such a highly addictive drug, and some of the things, why is meth so different than other forms of drugs that people are using?
Right. Well, I think what's happening is that when a person uses meth, the amount of chemical that's released in their brain is not just one thing or the other thing. It's this multitude of hormones that are released in the brain. So they get this dopamine rush, they get an adrenaline rush, they get a serotonin rush. We use those drugs to help with depression or anxiety, but what's happening is a person using meth gets all of that essentially at the same time. They feel fantastic. They feel on top of the world. They're high. And that is a feeling that I think people want again. But what happens is the body actually stops producing those hormones on their own. And so the only way they could feel good without it is to use it again. Because their body can't release those hormones like they should.
Okay. So, Dr. Tingley and Dr. Schmitz, can you talk a little bit about, maybe what providers should be looking for or should be seen in the, when they're looking for, or they have a suspicion of meth use? Can you just talk a little bit more about that? Maybe both, one of you start and the other one can chime in.
I can start, yeah. I think in the medical world, it's a very standard question that we ask of all patients when they present to the room for any sort of visit. We are going to ask them, are you a cigarette user or a nicotine user of any type? Do you use alcohol? Do you use any other illicit drugs? So we're always asking the question. Oftentimes, as you're building rapport with patients, it takes time for that to come out. You have to be able to build trust with patients before they're going to disclose something like that to you. But what I think we have to be aware of is the way in which patients present to the clinic. It can be very hidden in terms of somebody's coming in and they're saying, I'm incredibly anxious. I can't get my brain to slow down. You shouldn't just jump to, I think they're using meth. You would assume, well, maybe they just have anxiety. But you get them back in after a week or two, it's still going on. You're building rapport. They may tell you that. Or I've had plenty of patients that come in with terrible rashes. They're so itchy, their skin, they're just crawling out of their skin. And after a while, you start to find out, oh, shoot, I know that they're using meth. Or I just saw a record from the ER that they got drug tested, and now you find out that they're using meth. So you have to be kind of aware that it could be there because it can present itself in so many different ways. But anecdotally, what I'm seeing in the clinic is more the anxiety, the agitation, and the skin conditions. That's what I'm seeing.
Okay.
Yeah, I mean, as well said, Dr. Tingley. On our end as dentists, I think that, again, when they're high, we are not seeing them at those times. Dental caries is a chronic disease. Teeth are strange in the sense that they can be infected within the mouth for long periods of time without causing any real acute symptoms. And so we often see it on the backside when maybe they're in recovery or in a phase where they're not using the drug, where they realize, wow, this really hurts, or they have a tooth that becomes an acute infection and they present to us. But again, it goes back to building rapport with those patients. Like Dr. Tingley said, you don't always come right out and ask those questions.
So you've built the rapport, and you've just, you're able to get that confidence with the patient, and they tell you this. So let's, and segue into Sherry now, why don't you talk a little bit about what do we do then in the clinic then to, say, okay, let's take this the next step then.
Yeah. And we really do have to take next steps when we're talking about people that are using or abusing methamphetamine. We are going to need help outside of what I can do in the exam room with a patient. What we will do down at Falls Community Health, and I'm guessing this happens at clinics all across the city, is we will refer then to an addictions counselor. We will refer to a substance abuse counselor. We will refer to places like Carroll Institute or Keystone, places that have a dedicated treatment program for meth. Because it's very difficult. I think I'm excited to hear from you because it has to be a very comprehensive approach to treating that particular substance. In the clinic, I can treat things like opioid dependence. We can do that now in the office. We still need the help from chemical dependency and addiction counseling, but there are ways that we can do that. With meth, we have to reach out to our outside resources.
Okay.
So that's where we would refer to people like Sherry and others at Keystone and Carroll and
All right,
all
well,
those
this
places.
is a great segue then to you, Sherry. You work with treatment and recovery. Can you talk to us about that and share what do you do to help someone get over the addiction of methamphetamine?
Sure. Well, first I want to say, this has been said before, meth is highly addictive. And so a user builds a tolerance very quickly within weeks to months. And what I mean by tolerance is that they have to take a higher dose in order to get that same higher effect that they got at the beginning. And so they keep on trying to chase that high and to still get that euphoric feeling that they felt. Now, some things for people who may have loved ones or someone they care about to look for signs and symptoms. I just want to go over a few of those things, and some of them, tie into what they were talking about. First look at, there's going to be a change in their appearance and their physical appearance, including the deteriorating hair, skin, and of course the teeth. Decreased appetite and unhealthy weight loss. They may lose their money or constantly want to borrow money. Sometimes they're selling their items, pawning things, and even stealing at times so that they can get their fix. There's a lot of secretive behavior that goes on within the family so that they can continue to use and hide that from people. Irritability, violent behaviors we see often with meth use, and then those mood swings. There's going to be depression. Oftentimes there are suicide ideations as well, and that's something that we need to monitor closely. They'll neglect things at home. Their work will decline in their studies. You'll see a withdrawal from family and from the friends that they used to be close to. You'll see them changing those friends, or they're no longer hanging out with the people that are non-users. Irregular sleep patterns. They're going to sleep less often, sometimes not even sleeping for days up to weeks. And impairment in thinking and memory. Again, she spoke on the skin, so the obsessive picking of their hair and skin might be a sign as well. Excessive sweating comes along with meth use, and that's not due to physical exercise, or the heat. And just letting themselves go. Their appearance, they may not shower or just take care of their hygiene issues. You will find that they'll have jerky, erratic movements, and sometimes you'll see that they do meaningless, repetitive things like taking apart electronics or household items for no apparent reason at all.
Okay.
There's also psychotic behaviors, and that's characterized by paranoia and hallucinations that are a part of the meth use. And then, of course, if anyone notices that there are any paraphernalia, the glass pipes, which I'm sure have been covered already, the burnt spoons, cut off straws, and of course needles.
Okay, all right. So these are all the things that lead up then to, and things you probably see when they first enter treatment. Talk a little bit about treatment. Talk
Sure.
a little bit about perhaps the challenges of being able to get to recovery.
Yeah. Well, I think probably the biggest challenge is getting them in the front door.
Okay.
There are many treatment options out there. First, they would need to get an assessment completed in order to determine what level of care they're needing, whether that be intensive outpatient to inpatient, depending on their use. So we would look at that. Carroll Institute does have a meth-specific program, and so while in treatment, they can expect to learn more about their addiction.
Okay.
And more importantly, learn to love themselves again, because oftentimes they, forget who they are because the meth takes over.
Okay.
Okay, so learning to love themselves. The program incorporates relapse prevention, cognitive behavioral therapy, psychoeducation, and 12-step programming.
Okay.
They will also be processing their emotions. There are a lot of emotions, pain and hurt go along with the meth use because of the actions that they tend to do when they're using. I hear patients all the time tell me that, if I was clean and sober, I would have never done this or that, whether it be sleeping with someone who they didn't know, sleeping with someone in order to get the drugs, stealing, things like that, and hurting their family.
Okay.
And so, a lot of that is processed. Also, we process, co-occurring issues because there's mental health.
Mental health.
Mental
along with
health
the-
and addiction.
Okay.
And so a lot of that goes hand in hand. So
Okay.
that is also a big part of it as well. And then, of course, learning new coping skills. Because if they get into an argument or something happens, their immediate response is to go to use, because that's how they've
Okay.
coped for so long.
Okay.
So learning how to deal with things without the use of drugs and alcohol. Another big piece is we do have a family program component to it. And that is huge because we all know that meth not only affects the user, it also affects those close to them, parents, spouse, children, and those close relatives. And so that is also a big piece of that. So the family also comes and they learn to heal themselves. They learn communication and relationships, learning how to build those healthy relationships back.
Great. Well, okay, it is clear that methamphetamine use is dangerous, it is highly addictive, and very devastating to the individual and their family, friends, those that they surround themselves with.